My name's Jess Hutchinson. I'm Assistant Director responsible for Learning Disability Services. I'm part of Hampshire Adult Services or Hampshire County Council. And I am the senior person responsible for the Integrated Personal Commissioning Programme, or as we call it, My Life, My Way in Hampshire. Being able to take an opportunity to step back and look at the whole picture from a holistic point of view for an individual and starting with the person is something that every single agency has talked about for a lot of years. But it's very different to actually start from that perspective and look at the outcome from the person and start there. So I think that's a real difference, and it's quite radical actually in terms of taking that kind of whole systems approach. I would like to think that we achieve fantastic outcomes in terms of reducing the number of beds we have in assessment and treatment units. I think the kind of where we want to get to with the Transforming Care Partnerships absolutely fits with our outcomes that we want from IPC too. It's also about preventing people needing to be admitted to institutional care. So if this was a success, I'd like to see far less people using residential care and far more people choosing how they want to live and who they'd want to live with, and having far more of a role in terms of making choices about the kind of care and support they receive.
My name is Gail Bedding. I am the CEO of Hampshire Parent Carer Network, the parent carer forum that deals with Hampshire Local Authority and health. And I've been involved with Hampshire Parent Carer Network for the last 2 years. And because of that, I am obviously a parent of a severely disabled young man, Fergus, who is 11. I have been involved with the IPC from the very beginning, and I sit on the IPC board, and in Hampshire we call this My Life, My Way, which makes it a bit more real in terms of what it actually means. For me, as a parent of a young man, over the last few months I have been through the transfer from statement to education healthcare plans, so I've sat through probably a 2 or 3 hour meeting for that. Just recently I've sat through a personal budget form filling exercise for social care, which was another 2 hours. I've also been through a person-centred planning session with my son, which was a whole morning. And what would have been really nice is for all of those things to be done at once, with all the same people in the room that obviously look after are involved with Fergus's care. And that for me is what I really want IPC to be doing, is to bring all those agencies together in one room, so I only have to spend with my family 1 session deciding on Fergus's future and how that will work and who will actually make it happen. To get to that point where IPC is really working well, it's for all the agencies concerned to work together, to talk to each other, to stop working in silos, and to make each other realise how important it is that they can make a difference to people's lives just by making it simpler and by them all sitting in a room together.
I'm Jenny Steeples, I'm from Hampshire. I have a daughter of 38, Claire, who's had a personal budget, social budget, for the last 9 years. We live in Hampshire, and when IPC, the bid came along, I was asked to be involved. Claire had 23 years of residential care. She has blossomed over the last 9 years with a personal budget. It's no more expensive than while she was in residential care. She really has a life now, where she had just an existence before. I hope that it'll become the norm for everybody. I would like to see all residential homes closed, and I would like to see that people getting the life that they want and developing as they should be. People are used to what has happened before, what's traditional. They're nervous to do it. We were nervous, but we did it. There's not enough publicity out there about the positive side of it. We need to get the media on board to realise that it's not any more expensive, and just because people do things that are imaginative, it doesn't mean that they're wasting public money, and that things like horse riding, that saves quite a lot of money. You don't have to have a physiotherapist when you go swimming. Some of the things that my daughter goes sailing, that is so useful for anyone who's stressed to go out on the waves. It's a way forward for people.